guys, welcome back to another episode of the Red Line Talk Show. Today we have the pleasure of speaking with Tina Lula, an accomplished advanced practice nurse whose career spans for over 25 years. Tina has dedicated her life to healthcare, working in fields as diverse as primary and critical care, integrative medicine, and now focusing on hospice and palliative nursing. Tina, welcome to the show. We're thrilled to have you here to share your incredible story and insights into the world of nursing and community service.
Thank you so much for having me. I'm excited to be here.
So thank you for coming. We always want to ask the guests first to tell us a little bit about their background.
Like, who are you? Who is Tina Lula?
Who am I?
Where you born? What part of Albania you're from?
So I'm born and raised in Staten Island. Staten Island kid my whole life. Went to school there, went to undergrad, graduate school at Wagner College. My family is actually from Ulqin in Montenegro. My parents at that time, when they migrated to America, it was actually the former Yugoslavia. So my dad left communism. And as a child, all I knew was going to visit Ulqin in Montenegro at the time. But I went to Yugoslavia, actually. So that was what I knew until it eventually became Montenegro at the time.
What year was that when your father came to
My
America?
father came in the mid 60s, like 1964. He came to America. He was actually one of the first Albanians to come from Ulqin to America.
So as we were prepping for this, it's something for the audience to know as a fun fact, we realized that my grandfather and her father were actually the first Ibran, the first Ulqinak that came together and united the Albanians in Staten Island, which was so crazy.
All these like 9 degrees of separation, and you come together. It's wonderful. And you start to realize these things. Yeah, it's great.
So you have a career in healthcare for 25 years.
Yes.
Right. What initially inspired you to pursue nursing?
You know, it's interesting. I always wanted to be a teacher. I was going to be a high school teacher, believe it or not.
Did I.
Yes.
I was going to be too.
I was going to be a biology teacher. I went into Wagner College thinking that I was going to be a teacher. That was something that I always thought of. And one day a friend of mine was like, I think you'd be a great nurse. You want to take a nursing class? And at that time, you could do those kinds of things. Now you have to actually apply to go into a nursing program. I took a course and fell in love with it, and I realized that nursing is so diverse that I actually teach nursing school now, and I have a degree in education. So it's like you can take your passions and really put them everywhere. That's the diversity, and that's the beauty of nursing. That's why I love it so much. So in my mind, I was going to be a bio teacher teaching high school, but here I am now teaching a passion that I love and instilling how I believe nursing should be to the next generation. It's a wonderful thing.
The diversity in the field in healthcare is just amazing. So not only can you be a teacher and also go into healthcare for nursing, but if you have a passion for computer science, but you also like nursing, that's another way that you can actually marry the two. And with the healthcare system going into this electronic medical records and all these other things, you can actually work in both fields. Same thing with law and nursing.
Yes.
So there's so many different things you can do. You don't have to pick one. You could actually double major.
Exactly. I instill that in my students because I love to teach as like my other part of my profession. And I tell them the world is open to you. You have an open book in this profession. And don't ever look at it as I'm just going to go and work in a hospital, which is wonderful if that's your, career path.
Right.
But so many doors open up for me and for myself, but also for my students. So that's what I always tell them. It's wherever you choose to go with it, the doors are open.
So similar to your experience, I also born and raised in Staten Island. High school, it's crazy because we only met each other just a couple of months ago.
Exactly.
Undergrad, I did at Wagner College as well.
Yep.
I was part of the physician assistant program too, so I did the route of physician assistant. But I also had a passion in business too. So I ended up getting a dual degree and got my executive MBA and also became a physician assistant. And with my career, just as you did education and healthcare, I did business and healthcare.
You can marry the two.
And I ended up working in various administrative roles within the hospital. And that's another, type of thing that
Healthcare
you can...
executive.
Yes, exactly.
It's beautiful.
So as an adjunct professor at Wagner, right? How do you approach teaching and mentoring the next generation when it comes to nursing?
That's a great question. As a professor, I always like to reflect on my personal experiences. And when I'm out there teaching my students, we have to give them real world experiences. So you could be learning from a book, but when you're actually out there performing the skill, and I bring back the fact that you're actually caring for a real person here who has real feelings, has families, they're going through so much. So always look at the real person that's in front of you and don't look at the diagnosis. Don't look at what you looked at. Let's look at this person. They're never going to be exactly what they learned clinically from a
Mm-hmm.
textbook. So I always like to take my personal experiences and instill that in the students because what happens is it clicks with them. They
Right.
actually start to see, like, I remember learning this in class. And now that we're actually caring for this person in front of us, and you're giving me reflections based on my experiences that I've had, really helps them to understand and put the puzzle together.
So in a way, do you teach them how to have empathy, I guess? And can you really teach that?
It Nursing is built on empathy.
Right,
Can we teach that? We can, but I also feel a lot of it is innate. It's something that's in you.
right.
It's like a level of emotional intelligence. One of the first things I always ask my students, and I say, "What brings you to this profession?"
Mm, that's a good point.
And
Yeah.
and many of them then reflect back on their life, and it could be whether it's nursing, whether it be a PA, whether it be, they're going and becoming doctors. Many of them look back on their life and say, "My mom was a nurse. I
Mm,
had an experience X in my family." So they look back
Mhm.
as to what brought them into this profession, and many times it brings on because of some experience that they had. So can you teach empathy? It comes from a skill set that they've developed over time. And that's what I like to see. When they say, "I'm here for this particular reason,"
Right.
that's when I know that we have the right person here for this particular field of medicine.
So, like for myself, what brought me into healthcare was I had family member that was ill at a young age, and I was young at that time, and I felt helpless, and I knew
Yeah.
like I never wanted to be in this helpless position ever again, and I knew it was a long road because I was only 12 at the time. But I knew that okay, I had to study hard in high school. I had to get into see what type of healthcare positions are out there because it's not just doctor and nurse. There's doctor, nurse, there's pharmacists,
Yes.
there's lab technicians, there's ultrasound techs, radiology. There's so many different divisions. So I explored each one to see what was the right fit, and made sure that I did everything in my power to learn everything that I could about the healthcare industry,
Mhm.
the healthcare world, and make sure that I had the knowledge to never feel helpless again when a loved one gets ill. So that was my personal experience. So to answer your question about empathy, as Tina said, most of the times people who go into healthcare, they just have that in it's innate. They have it
Yeah.
in them.
Now, I mean, you're a professor. Are you a tough professor? Are you a fun professor? How would your students describe you? Well, did you fail anyone, first of all?
No, I have not. I have not because I think especially at a point when they're getting into their 3rd and 4th year of college, I always like to sit them down, especially nursing, especially in healthcare in general. And I know nursing because what I teach, and I tell them, take this seriously. This is your career path. We were all young kids growing up. We wanted to live the college life and party, but this is what you're going to do in the near future, in the next 2 years. Look at your life and study hard because in the end, you need to pass those boards and care for a human that needs your help. Um, in terms of what type of a professor I am, you have to be a human. You have to be humanistic,
Yeah.
and you always have to reflect back and remember that you're dealing with individuals that are not at your level at this current time. They're students. They're learning from you. You have to show a humanistic approach to being the type of a professor that you are so that they can relate to you as well. And they can feel comfortable coming to you when they have a question. I always tell them, ask me questions. There's no wrong or right answers, and I will answer to the best of my ability. If we don't know right now, we have answers right at our fingertips that we never had growing up when I had to look into books, and we don't have everything is on phones now. But it's about showing like a real humanistic side where your students can feel comfortable, honestly.
So you currently are working in hospice and palliative care, and that requires a very deep level of empathy and compassion, which you're teaching your students. And
Yes.
I know you have that within.
Mm.
Can you explain to our audience what is palliative care, what is hospice, and also what you had to do and the experiences that you've had in the clinical work that you did that brought you to that point?
Great questions. So there's multiple questions.
Yeah.
I should say answers there. So palliative medicine and hospice, they go together. How did I get involved with this? My career path has taken me from critical care medicine, taking care of people coming out of surgery, getting them better as a young nurse. And many times, unfortunately, yes, they come in for care, but they can go in a different path and something can happen to them and they can get towards end of life. I was always that young nurse that if somebody was actively dying, even in my early 20s, I would go into the room, provide them support. Many people are fearful, especially a younger generation. They don't walk towards that fire. They're like, I can't, it's too
Right.
emotional for me. So they
Right.
walk out. I remember being that young individual going in the room, holding someone's hand, giving tissues. And I didn't know what I was doing, if I was doing the right thing. I just emotionally, I felt like it was the right thing. So I was always drawn to that emotional experience, even as a young practicing nurse. So my career path went from caring for people in a critical sense to then developing teaching skills to teach individuals and then working with individuals in a healthy perspective. How can I keep people from getting ill? How can I keep people? So
Preventative.
I did a lot of preventative medicine. And even to this day, I practice preventative medicine with my own family, friends, my patients, but even as my own self, like holistically. How I got into hospice, I always felt that it was something, was a calling for me. And it really is. If you ask people who do what we do, it's not something that people run to say because it's not glamorous. It's
Yeah.
not the glamorous side of healthcare. And but it's really like it's something innate that tells you this is where I belong. So for me, it was always there. And I had applied, interestingly enough, I had applied for a position as a manager in a different organization. And I had trained as the manager, and they said, hey, we have a position as an NP for hospice care. We really think you'd be great at it. And I thought about it that moment, and I said, you know what? I always wanted to do it. Let's do it. And I was already in this organization as a manager. And I said to myself, this is the right thing. This is for me. And I just went with it. And people were like, you sure you want to work with people who are dying? Like, that's so heavy.
Yeah.
It's just a matter of perspective, how you see life and where you want to go with it. As per palliative and hospice care, palliative is different. You get a diagnosis. Someone has a diagnosis, whether it be a cancer diagnosis, we're going to give, for example. And it's about managing that patient in a holistic sense, looking at them not only with the care that they're receiving. So if they're at a hospital that provides all of this, they'll call the palliative team to look at them in the perspective of, are we managing their pain well? Do they have social services and needs? How are we taking care of the family as well? Because it's not always about the patient. We have to care for the family that's caring for the patient. So as the patient goes through this care in terms of their diagnosis, at some point, not all the time, they then tell the patient, listen, we've done everything we can. This diagnosis now has gotten to a point where it may be terminal for you. What is terminal? Terminal is 6 months or less to live as per a diagnosis. So then that's when they offer a hospice
I
service to
see.
them.
So I guess if you wanted to simplify it, hospice is the moment where you know that person's gonna has a timeline of how
Yes,
much they have left,
perfect.
right?
That's
And
exactly
then
it.
palliative care is the process of getting there.
Exactly.
If
That's
I wanted to
exactly it.
simplify it, right? Because I just learned about this recently, and it's such a fascinating world that you work in. So kudos to you.
Thank you.
I
Thank
don't think
you.
that I can do it. But I guess there's so many questions around that, right? Specifically for people that are not comfortable dealing with that type of situation. How would you approach it? What would your advice be for someone who's going through that now, to make it, I guess, easier for them or to give them more insight into this whole process?
When patients and families are going through it, you have to come together. If you have the family support system, I'm sure Eliana, you can see that
Yes.
in the field. You know, you're doing the pretty much the same care that I have provided. You have to involve the family, sit them down. You have to be very honest and letting them truly understand where their diagnosis is and where their prognosis is. Their prognosis is, what does this look like? What is it going to look like for you? And really being honest with the families and the patient and saying, where do you see yourself going with this? You have had this diagnosis. You've gone through rounds of chemotherapy, rounds of radiation. And I'm looking at the diagnosis of a cancer
Right, right.
because we take care of patients with many various end-of-life diagnoses. And looking at them before they get to the point where they can't speak for themselves. Where do you see yourself? What is your ultimate goal in your life? If you're going to get to a point where you can't care for yourself, who's going to be that individual that's going to be your voice? What does end of life look like for you? And some patients will say to you, I want to go home. Like, I want to be home. And can we provide that home environment for that individual and bring the services at home for them? The care is available. It's just a matter of, will the families be receptive on getting the care?
That's a good point.
And I'm
And
sure there's been many situations. I know because I've had these conversations directly with family members personally and also in my work,
yes,
where the family are not in agreement, where some of the family members, you know, are understanding what hospice or palliative care is. But let's focus on hospice for this moment.
yes,
And others think that you're giving up on their mother or
yes,
their father or
yes.
you know, their loved one. How do you navigate that? Because one of your key roles is educating them what it is and what are the misconceptions and you know.
There's so many misconceptions. And one thing we always talk about is when we say hospice, they're like, oh, don't mention the H word, that H word.
Nobody wants the C word or the H word.
Yes, don't, and because that's what
C
they
for
know.
cancer.
Yes, exactly. So they'll say,
Let's clarify that.
they'll say, you can say you're the palliative nurse, but not the hospice, because they're afraid of what's happening.
Right.
The biggest thing is getting the education out there, having the families to understand what we're providing to that individual, and always looking at from a holistic perspective. What can we provide them to keep them comfortable? If the family member knows their goals of care and they know their goals of care, how can we marry that and provide the best services for them in the home? And many people don't know of the great services that we provide in the home. It's not just about having a nurse come to your house and take care of you. When a patient goes into like a hospice or a palliative program and they want to be home, that's their goal. So not only do they get a nurse coming in the home to care for them on a weekly basis or even sometimes even more frequent basis, they're provided a home health aide, which is based on how many hours they can get, up to 4 to 5 hours a day, to help offset some of that the family member is providing all that care. We basically make the home like a hospital if that's what they want. We provide all the services, whether it be a hospital bed, whether it be oxygen, all the medications needed for end of life that we provide and educate the family to provide. We have social services that comes on board. We help them with bereavement services. So what is bereavement? Sometimes people say, bereavement is, how do you deal with the grieving process when someone passes? So when someone comes into a hospice program, they actually get 13 months for the caretaker, the caregiver of bereavement services. We offer grief counseling because a lot of people don't know how to deal with that heaviness
That's
of,
very true.
of loss, the loss that they're dealing with. We even do memorial services, believe it or not, which is beautiful. So we'll gather up all of our patients, say for the year, and they'll do like a memorial service and they'll write cards and they really work on how to process that grief of that individual that they love and lost.
So I want to tie it a little bit to the Albanian community,
Yes.
right? Because I feel like
Yes.
we don't really like to talk about this
know.
much.
Very much so.
And
Very
when
much
this
so.
happens to us, we tend to deal with it however we know to deal with it, right?
hmm
And I want you to maybe educate us a little bit about that, as far as when is a good time to talk about this, whether you're going through it or not, right?
Okay.
It doesn't matter. But do you feel that us as a community really know this service that exists? Number one, are we really educated around this topic?
We aren't. And it's not just the Albanian community, it's many communities, whether it's the Hispanic community,
Yeah.
um, our Black communities. It runs the gamut. And I know that the audience here is a larger Albanian audience, but
Right.
it's honestly culturally it goes across all cultural divides. Honestly, um, what what helps, I think, when you have a team, having people in your team, like on a hospice or a palliative program, from different cultures and backgrounds. For myself, because I've in the work that I do, I've serviced a lot in the Staten Island community, which we have a large Albanian
Yeah.
population, and I have a lot of Albanian patients and family members that I've cared for. And now I cover Brooklyn and Queens, and it's the same thing as well. It's helping them get a better understanding. A lot of times they feel like I'm giving up on my dad, I'm giving up on my mom.
Yeah.
Um, I always like to reflect back on my own personal experiences, not just as a hospice nurse practitioner, but I too had to put my father in hospice. I too had to make those difficult decisions. And it wasn't about just me. So the question you had is, when's the best time to ask this? So if you have a family member that you know that they're either maybe cancer care, whether it's end stage renal or whatever diagnosis that's a chronic end of life, congestive heart failure, we have so many of these patients. It's about picking the right time to talk to that loved one. And I can tell you, like, for my dad had end stage renal failure, and he ultimately ended up going and he had Alzheimer's dementia. And I started seeing it in his 70s, and I saw his decline. But in our population, we are like, no, no, there's nothing wrong with him. No, no, no. And from my professional experience, I knew that this was going to be a long road, and there's going to be a point where I knew he was going to decline. And I had those difficult conversations with my father because I had that relationship with him.
Did you have resistance from other family members?
Yes, my mother and even my siblings, my two brothers, they were just like, why are you talking about this? Like, Bobby's not going to die.
Yeah.
But you always have to see the future ahead. And I saw that, and I remember I clear as day. And if I didn't have this conversation, it would have been easy. It would have been harder for me towards my father's end of
Because
life.
now they're putting basically all the decision making up to you versus now you being able to say, well, we had this discussion with Bobby. We know his wishes are, he wants to be at home or he wants to be in a
Yes,
hospital
exactly.
or a lot of people don't even have the discussions about, what do they want for themselves of DNI or DNR.
Yes.
So for those that you don't know, DNI is do not intubate and DNRs do not resuscitate. So these are all like crucial conversations that have to happen either when you do get one of those diagnoses that
Yes.
are terminal or chronic conditions, or even when you're healthy and you're totally with it and you're just talking about different scenarios.
So so that was my question. I guess is knowing when to have that conversation when it comes to your parents, right? Because we know they're not going to be there forever, right? I know it's a very uncomfortable
It's uncomfortable.
topic
It
to
really
talk
is
about,
uncomfortable.
but I'm wondering if there's a way to introduce this at an earlier stage where you can have a meaningful conversation with your loved one to say, hey, this is bound to happen.
Yes.
How do we deal with it? Do we deal with it now or do we deal with it later on where we all stressed out and we don't really know? Do you offer that type of guidance in the beginning
Counseling.
or counseling?
We do. And because a lot of family members don't feel comfortable talking about it. And I know, like, for myself, I feel comfortable. So had the conversation with my father, and my mom was like, why are you bringing this up? That's so bad. And I was like, no, it's not bad, because I want to know what his plan is for his life. And I want to follow that plan.
That's a good point.
And he told me, he said, I don't want no machines, Bobby. He said, no machines. And I said, okay. And I never knew, go fast forward a couple years down the line, that I had to make that decision. I had to sign a do not resuscitate and do not intubate on my own father. And even as a provider where I do this on an everyday basis, it's the hardest thing
It
to do it
affects
on your
you.
own
Yeah.
on your own parent. It's the hardest thing to sign.
And especially if you have siblings who aren't in the healthcare profession,
Yes,
and
they
now
don't
you're the one making
understand
all the
it.
decisions.
Exactly. They don't understand it. So if it becomes difficult, if I always tell family members, if you can't have that conversation, there's people that you can go to. So if your loved one is going through a terminal diagnosis of a cancer, say, for example, utilize the people in the hospital setting, utilize the people in your loved one's medical team to bring up those conversations, because that's what we're there for. No, we talk about this. I have many a patient that come on to hospice. They still full code patients, meaning that, they don't sign a do not resuscitate, do not intubate, but we take them on to service because they are at end of life. And it's educating the family member and saying to them, how do you see this loved one of yours? Do you think that they're going to survive if they have this end stage, end of life disease process? Do you want them to go peacefully? Is that what your father and mother? So we educate them throughout their journey, basically.
Mm.
It's a journey.
So medicine's constantly evolving. There's a
Yes.
lot of new treatments that are happening now that didn't exist 10 years ago. So something that somebody would have passed away 10 years ago, maybe today are being cured. Can you talk to us a little bit about if someone goes on to hospice, but yet they're full code, they're still receiving all the treatments, and now a miracle happens and they actually start to get better? So a lot of people think once you're on hospice, you can't get off.
That's
Right?
a great
So I would
question.
love for you to
It's
talk to us
such a
about that.
great question. It's so interesting. So like, say for example, like a diagnosis of something that has a longer trajectory, like Alzheimer's dementia. So you can go on and have Alzheimer's and you could be on a program and then you could say 6 months and that's it. You're 90 something years old. But here it is, they are still on hospice, and here's a year later, a year and a half later, and we're like, you know what? You're doing great. Now it's time. You actually have to graduate hospice. And everybody's like, what do you mean?
Oh
I'm
my God, there's a
graduating?
graduation.
Yes. And I say to them, I said, you actually outlived that time frame, because there's guidelines that we have to follow. There's actually regulatory guidelines to keep people on. If you look at President Ford, he's been on hospice over a year. He's 99 years old. He's going to be close to 100. And when they always talk about his life and he's been on hospice for over a year, that means he's getting great quality care and they're providing services in the house. Everything comes to you and he's doing wonderful. Because he's President Ford, they're going to keep him on the program.
Yeah.
But if I've had somebody
Advertisement.
over a year, it'd be like, you know what? You haven't. You've actually met a steady state, and you've actually gotten to a point where you're a point of graduating. And they're like, but who graduates hospice? You actually do. And they always can come back at some point, because decline can happen like this. So we say to the families, you know what? We're going to graduate you. We're going to get you back into the community, getting the care that you need through the community. And then they can always come back if something, a decline
Do
happens.
they get a certificate of completion?
They asked that question. That's a good question. They're like, I graduated. Who graduates hospice? I said, many people do, believe it or not.
I do want to go
So-
back to the question that had been had. When is the right time? Like we have, thank God, parents right now that are very healthy, and we can't even just imagine them not being here 5 years from now
Of
or 10 years
course.
from now. However, there are conditions that can happen, without notice. Like for example, a massive stroke or a massive heart attack, and now
Yes.
everything changes instantly. So this is why it is important to have these discussions,
100%.
at any age, just to know. And then you could always keep revisiting these same topics to see maybe
Yes.
your mindset changed for
Yes.
whichever reason, or based on the circumstances. So as long as you're alert, you're oriented, you are able to make decisions for yourself. Right. You should continue to have these discussions periodically to make sure that your loved ones know exactly what you want. So you don't put that burden on your loved ones to make those decisions when you can't make those decisions.
You want to be in the right alignment. There's never the right time, but there's always the right time to ask. You And the reason I say that is because it always can make someone feel uncomfortable. So if you say, Mom, what are your wishes if you are going to get sick and I've been taking care of you and you have X, Y, and Z medical problem? What do you want me to do for you? I want to know because if I ever get to that point and you can't make decisions for yourself, and if, say, it's your mother or your father, let them designate who they want that person to be. And a
Mm.
lot of times it's not like if it's a married couple, sometimes it's not the spouse that's making that decision because maybe the spouse has too much emotion
Right.
attached to it. I mean, I know for myself, yes, it was my father, but I had the right sound mind to follow the wishes he wanted. So it's finding that individual who's going to actually listen and say, no, this is what Bobby and Mommy wanted, and I have to follow that. So there's never the right time, but there's always the right time to ask, if that makes sense, because
Yeah, no, it
it
does.
makes people feel uncomfortable.
Right.
But those deep conversations need to be had. They're so important.
But I want to dive in a little bit further into that, right? Because specifically, what are some of the questions that we should be asking? For example, if I want to know from my parents, right? Um,
Hmm.
like, where do we start? Well, what's the starting point? Is it to designate a healthcare provider for them to make the decision, like you said? Is it to understand what their wishes are if that
Yes.
were to happen? Even planning as far as buying a lot, uh, you know,
A burial lot.
a burial, yeah, a
Yes.
burial lot. A lot of those conversations we don't have, and then if it happens, then you kind of you're struggling to get everything done.
Hmm.
If you were to plan ahead, I know it sounds crazy, but you're
No,
planning ahead
it's a
your
great question.
your death. But is that normal thing to do to plan ahead when it comes to
I
this?
think if we plan ahead, it will make the end of life decision so much easier for the people who are providing the care.
And they could actually be able to
Yeah.
grieve and be support instead of trying to do logistics and running
Yes.
around and
Yeah.
feel like they have the burden on themselves.
So, like, for example, like in the Albanian community, a lot of people say, I want to go back home. I want to be
Yeah.
buried back home. So you can prepare for that. And looking at your finances, can you afford to bring your
Right.
father or your mother back home? Do they have a plot bought over there? Prepare for that. Hospice, as much as it's sad, it prepares people. If you have enough time, if you're in a palliative program, we work with you and say, what are your wishes? Do you want to be buried here in the United States? Do you have a funeral home that you've picked out? Have you, and these are those difficult questions
Yeah.
you don't ever think about. Have you bought yourself? Do you know what cemetery you want to be buried in?
But so do you guys provide guidance around that then? So if I were to call, do I just call a number and say, hey, I need help with A, B, C, D, E? Do you then come and have a consultation with them at their
Mhm.
home and then walk them through a package or something?
Okay.
Like I'm trying to
You're
understand
trying to
the
put the
service.
pieces
Yeah.
together. So for hospice in general, it can be a referral that can be referred from your provider. Like
Right.
you're in the hospital and they say to you, you know what, there's not much more we can do.
Right.
Like you can't enroll a loved one
And
into hospice. It has to. You have to
actually,
go through.
So it has to be a trigger.
there's a misconception there.
Really.
So
See,
that's
look,
what
and I'm in the profession. I
Yes,
had a
so
misconception.
that is a misconception. So if you're caring for someone and you know that they have a poor prognosis and you're struggling, and you
Oh,
say,
yeah, that.
so
Yeah.
you can call a local hospice organization.
And ask
So
for
we
a
have,
consultation.
and you can self-refer. And I always tell family members this because people will call me and say, Tina, I don't know what to do. I really think my father, my mother needs to go into a program. How do I go about doing it? I said, you can self-refer.
But
So
ultimately, they're the ones who are going to make the final decision
Yes.
to see if you qualify. So yeah,
yes.
that's what.
So the organization, then what we do is we gather information. So if I wanted to self-refer my father, I'm going to give an example of my dad. I called and I said, I want to self-refer. And then they say, okay, well, we need the medical records. We want to make sure, is this person really terminal? Do they have a diagnosis of 6 months or less to live? And then they gather the evidence, they review the case, and they say, yes, this person can come in. So you can make a family referral.
Right.
and say, I can't do this and I want the help. So there is a misconception there because people always say, oh, my doctor has to refer. I'm like, no, you can refer if you think mom is at end of life.
And you could even go to your doctor and ask them, is my loved one, my mother or my father or, whoever it is, should we be thinking about hospice? Is this the time to talk about hospice? So you can start those conversations.
That's great. So I understood that part, but I'm asking if the parents are fully healthy and we want to plan.
Okay, so planning.
He wants to know, so we could tell the audience as well, what are some specific questions to ask? Like, for example, if you were in a position where you can't breathe on your own and now you have to put a tube down and the only reason why you are breathing is because you're hooked up to a machine, do you want that? Do not resuscitate if your heart stops, and you have a prognosis that, you don't really have great quality of life at, even if you do overcome that. Do you want to be resuscitated again? I think these are the questions that they want to.
So there, many times when you have those questions asked, it's usually when you're in a situation like you have a diagnosis that the prognosis is poor. There is another document. It's called the MOLST, the Medical Orders of Life-Sustaining Treatment. What I like about the MOLST, if you ever encounter it in a hospital, it's like a big pink form, and it's pink for a reason because it's a difference. It goes through all of these scenarios. So it asks, do you want to be intubated if something happens to you? Yes or no. Would you like to be resuscitated? Yes or no. If you get sick, would you like us to give you IV hydration? If you need antibiotics, we could provide you antibiotics because there are some people who say, don't do anything for me. Do you want blood products if you get to a point that you need to have blood products? There are some religions that say, no, I don't want any blood products. Even if I need it, I don't want it. So the medical orders,
yes, they won't take it.
This form, Medical Orders of Life-Sustaining Treatment, this MOLST form, it really breaks it down even further. And that's being offered and that's out there. And we really try to use that more so because it helps us to say, no, I don't want to be intubated. But if you need to save me and give me antibiotics in the hospital or order some antibiotics
or IV hydration,
we will do that for you because that's part of your goals of care. Does that make sense?
Yes, it does. But I'm looking from a different angle.
So I think I know what you mean.
What I'm trying to get at is that this is a very difficult conversation to have with your loved ones.
Yes,
family,
it is.
Right. Can I just pick up the phone and call and say, Tina, can you come over to my house and talk to my parents about this? And you'll be that person to kind of educate them about the whole process of the end of life, what it should be like.
That I've done that for many an individual.
Is that part of a service or is it something that you do on your own if you know that person,
For myself, I will do it because you're asking me as a friend.
Right.
But you want to look at from a perspective of who can do this.
Right.
Many a time it's done because family members are not comfortable. It's part of advanced care planning. So if you're in a hospital setting or you're in your doctor's practice, those are things that should be discussed with you. Many a times it's not, unfortunately. That's the hard part because everybody looks at life-sustaining measures and how can we do this. So the conversation does have to start at home. And it does have to start. And it's a difficult conversation to have.
Yeah.
It's difficult for you to go to your mom and say, Mom, what do you think about this? She might look at you and saying, what do you think?
Is my son trying to kill me?
Yeah, exactly.
So we actually had this experience just a couple of weeks ago because I was, talking about palliative care and hospice. And, we really needed to get you on the show because I found that this is an area that many people don't know about.
Yes, they don't.
And I realized that when I personally was having a conversation with my husband, we just got married. So I'm like, he's my spouse. So if, God forbid, something happened to me in a hospital, he's the next of kin.
Of course.
He should know my wishes. And he didn't want to have the conversation. I'm not thinking about you dying. So I was like, that's not the point. So we actually started this whole discussion, which is what triggered, we need to have you on the show.
It's a beautiful thing. Thank you.
My question to Edwin is, thinking back a couple of weeks ago, and after kind of learning more about what hospice and palliative care and advanced directives are, do you feel like you are a little bit more well prepared in at least starting a conversation now, or?
Well, yes, 100% if something happened, but I want to avoid that getting to that point, right? I want to have that conversation earlier. So I have a peace of mind of saying, okay, we know what to do in case something happens, right? I know that's there.
Yes.
But I don't know what the wishes are of my parents when they get to that age, right? And now I feel like they're in a sound state of mind where they can think, for themselves, and knowing that they'll be able to tell me what their wishes are, right? Versus me trying to guess. I mean, I don't know if my parents want to get buried back home or here.
Yes.
It's a good
There's
question.
never
you
a
know?
right time to ask.
But that's what I'm
the
trying to
way
say.
I
Like,
see it
can we just
is
give you a call and say, Tina, come over for a coffee?
you could always
and
call me. I'm always available.
then we
I'm
can,
always available to give those
we can
difficult.
ambush, it's like, hey, by the way,
They're gonna
Tina
say, "Why
works in
did you call her
hospice.
over? Please
Do you know
tell
what
her."
hospice is? Tina, take it away. There you go.
It's more so about knowing their wishes. So having those difficult conversations, you could have those difficult conversations having a cup of coffee with somebody.
Right.
It can come up because you saw something on TV that was tragic and be like, wow, look what happened there. What do you think about that if something like that were to happen to you? So it's about how you frame it so that people
So it
don't
doesn't
say,
look like we're trying to kill our parents.
exactly.
Honestly, you could use this podcast. So whoever's watching the show, this
Yeah.
could be your platform of how to.
This can be your introduction to a conversation, by the
Introduction
way.
to the conversation. I just was
Be like,
listening
hey,
to Tina Lula,
Mom, Dad.
and this is what they were talking about. So what are your wishes? So
And the way I see it, it's not an omen. Like people say, "Oh, you're
Right.
talking about
Yeah.
death. Now you put an omen on me and I'm going to pass away." That was my mom when I brought it up to my dad. My mom's in the kitchen washing dishes and I'm talking to my father about it. I'm speaking in Albanian and my mom goes, "Oh, what do you mean? The Mahmoud Babur?" And I'm like, "No." And basically that means in English, you want to kill your father? And I'm like, "No, I want to know what his wishes are."
Yeah.
Because he has a medical diagnosis that could lead to
and not
that.
everyone has a nurse practitioner as their daughter
Of
that can do
course,
that.
yes.
And it's not fair for you. You should be the daughter and not the provider during that time.
I agree with that. It's very, very hard, honestly, towards the end of life. But it made my journey with him easier
Right.
because I knew what he wanted. And when he got to that stage, believe me, we did everything. And for your loved one, you're going to do everything in your capacity to
course,
keep them here and to get the care that they need. But when you're told this is that stage now, this is that transition stage, and you know what the wishes that they gave you, it helps you to get a better understanding of where you're going to be. And it actually helps with the grieving process, believe it or not. People don't realize when you follow, and I always say this to the people that I provide care for, when you're providing and listening to their loved ones' wishes and you bring them home and you have the care, when it comes time for that person to actually pass, the immediate shock will always be there, but then you reflect back and you say, I did everything for this individual.
Right.
And your loss and your grieving process becomes so much better.
That's a good point.
So I reflect back on myself and I feel so comfortable that I was able to do everything that my father wanted. So I always tell my families that I care for, I said, God bless you for doing this because you're actually providing something that they want.
Right.
And they never see it from that perspective because they're living through that end of life phase. And it's such a difficult journey. But then they say, you know what? This is what dad really wanted. And it really helps with loss. So think about even that journey is so important.
Yeah.
How are you going to process this grief, this loss that's come through your life?
So I want to bring another point. There are many people that after their loved one passed away, they felt a lot of guilt or regret, or I
Yes.
wasn't there when he died or she died. I wasn't, I didn't give enough time. I was there by his bedside the whole time, and some people that are listening may relate to this. I was there by his bedside or her bedside, the whole time for the last 3 weeks, and then the one time I go to finally go home just to take a shower and be a little human, that's when they pass. How can you walk us through that, grieving process and that guilt that some people have, and what advice do you have for them?
Oh, that's a beautiful question. And a lot of times people will tell me, Tina, what do you think? How much long does my father have or my mother have? And I can see the person and see how they look and what they're projecting. And I say, could be 3 days, it could be a week. So, based on how they present, because end of life, you actually have clinical symptoms. And I try to educate them on what to be prepared for. We can't actually say it's going to happen at this time and at this moment. Because I'm such a spiritual person and I look back at each individual case as different, many a times that I find with the dying is that you're providing the best care that you can for your loved one, whoever that person is, and you're there at their bedside and you're providing the care and doing everything you want to do. When it comes time to that transition phase where they're transitioning towards actually end of life, what I find is the person that's actively dying and they know who's that caretaker. They know who's there for them all the time. They know when the right time to go. And many a times it's when that loved one is not there because they don't want you to see them take their last breath. And
Interesting. Okay.
it really, and I see this so often that I say, it's okay that you walked away because mommy and Bobby, they didn't want you to see them pass away and actually take their last breath. And it's hard on the person who's providing that care. Like, I wasn't there.
But you were there the whole time.
Yes,
Right.
exactly. And what I tell family members, especially when they see those last stages of what end of life looks like, and it's really hard to see it. People don't realize it because people say, oh, this person passed away in their sleep. Like they think of death as instantaneous, but death is a process, just like birthing is a process. Death is a process that we go through, and people don't know about it. So our role is to educate people and say, well, I wasn't there when he took his last breath or she took her last breath. But many a time, the person that's actively dying doesn't want that. And you will see that in that journey. And I see that so often that I tell people it's okay to walk away from the room. If dad is not, can't communicate with you, but he's struggling. And sometimes that struggle is more internal. And it's just they don't want to see that loved one watching them take their last breath.
Okay.
If that helps.
Yeah,
that's
yeah. So
helpful.
I want to shift a little bit away from
from the heaviness.
Yeah,
It's so
well,
heavy. It's so heavy.
you have very strong ties to the Albanian community.
Yes.
Through your involvement with Shoqata Ulqini.
Yes, I do.
And you're also the coordinator of Meso Shqip School.
That's my heart.
Yes. Tell us a little bit about I've seen you in a lot of Albanian events, which I love. You're very passionate about. And you tell me a little bit about that work that you do, the volunteer work.
The volunteer work, because of the nature of what I do on an everyday basis, it takes me to just a far opposite end of what I do. And it brings, not that my work doesn't bring me joy, it brings me absolute joy in what I do. But the volunteer work is a completely different spectrum of my life.
Balance to your life.
Yes. And that's a big thing. If it's about finding balance in everything we do in life and saying, what can I do to balance out whether I have a heavy workload or just a heavy life? And what can I bring some kind of joy in my life?
Something fun.
And that volunteer work, so for me, it's about seeing the growth in our children, going to that school on a weekly basis, and they're learning culture, they're learning folklore, they're learning language, they're learning dance, and seeing how happy they are, seeing the teachers on a weekly basis Is it a lot of work to be a volunteer
Yeah.
and to manage a school with other volunteers? 110%. But we do it because it's something that's in us. And it, for me personally, it balances out the heaviness with the positivity. And seeing the kids on a weekly basis coming up to you, hug you, watching them as they grow and learn and truly love the culture and being there on a weekly basis, you start to see their growth as they've learned in terms of their language skills, their singing skills, their dancing ability. And I always tell them, I said, you guys are so lucky that you have this school. I wish I had
We
something
didn't
like
have it.
this because
Yeah.
we didn't.
No, we didn't.
We didn't because it was a different time frame back
If
then.
we did, we would have probably known each other from when we
Yes,
were
we
little. But no, we just found each other now.
Exactly. But it's never too late to find friendship. That's what I always say, you know.
So how important do you think is your role or the role of having, being involved with the Shoqatas and the school in our community? And are we doing a good job with that currently?
Right? I think we're doing a great job, but we could always learn and be better.
Right.
So it's like taking, and I always say it's about lessons learned. So what did we do now and what can we do better? How can we always make? So now we're planning like for this particular school year, we're like, what did we do last school year that we can keep these kids engaged, wanting to come back, wanting to be a part of the community, wanting to be a part of cultural events? I always look at the bigger picture because any type of after school program, whether it's a weekend program, after school program, it keeps kids off streets. It
Yeah.
keeps people learning. It
Right.
keeps kids engaged. So it doesn't have to be whether it's the Albanian community, it's anything that helps kids stay engaged and keep them within their growth and they get to see things. We could always do better because I always say, you can never be at the epitome of what you're doing at the top of your level. What can we do to make it better? So we're constantly learning to grow, which is so important.
So your job is very heavy. You're a nurse practitioner working in a very heavy field. Plus, even though this is more of a lighter, fun thing, but being a community leader, a teacher, having a school creating programs is still a lot. What do you do for you? And how do you?
That's a good question.
It's a very good question.
Because I get it.
What does
like,
Tina
the
do for
balance of the
herself?
Very good
two,
question.
but that's still a lot of work. Like, how do you find you time?
I am a firm believer, like for myself, in doing self-care. And I've people use that term and they throw it around.
Yeah.
But I'm big in terms of for myself finding the time to make time for myself to go to the gym. Whether if I can't do that, I go out for a walk. That's my form of self-care. I always tell people find that self-care that's important to you and make sure you do it. It's not about having the vision because everybody says I don't have the time. You make the time and it doesn't have to be something very complex, rigorous. It's what brings you joy and happiness. So for me, my joy and happiness is giving myself an hour each day to whether it's engage in physical fitness, doing a walking. And that to me is so important, especially in such a heaviness that we deal with. And you don't have to work in hospice. Any type of career field can bring you stress. What can be a stress reliever? So are you engaged in something that relieves your stress? And that could be volunteer work, something of that will bring you joy. So that's how I look to balance things. And I always educate my students that way. I tell them you're going into a field that's very heavy. Make sure you do the time to do self-care. It's that buzzword, but it's actually putting that buzzword into real work.
Tina, it was very lovely to have you.
Thank you.
We learned so much about you and about what you do and amazing job that you do currently. So thank you for being here.
Thank you for having me.
We
I hope
learned a lot, right?
Yes.
I
Are you
decided-
ready
I
to have
hope
these
this-
discussions with
No, I'm
our?
going to call you.
You can call me. I'm
calling you.
always
I'm going to
available.
invite you over for coffee and we can just,
Bring
start the
mom over,
conversation. Yeah.
bring dad over.
Yeah. But no, thank you for being here. We truly enjoyed it. And
It's my
hope
pleasure.
to see you again in the future events as well.
Thank you. You will see me.
Thank you, Tina.
everybody.
It's
Thank
a
you.
pleasure.
Oh.